Madam President, before I get to my topic today, I'd like to say that when Senator Sullivan first came to the Senate, I hadn't been here very long either, and this was my presiding time every week, and I love the Alaskan of the Week. I don't think they're ever going to run out of Alaskans of the Week as long as Senator Sullivan is here, and so I was just right back in that chair where you are, thinking of the many times I heard Senator Sullivan do the presentation on the Alaskan of the Week and how much I enjoyed it. I would say the topic today, tragic in so many ways, but I think moving forward in others. You know, last month, 19 kids were killed in their own schoolrooms. 2 teachers were killed at Uvalde, Texas. It was a horrific act, agonizing thing for family, an agonizing thing for community. And I think along with the Buffalo, New York event, an agonizing thing for our country. One thing that almost all these mass shootings have in common is a perpetrator who had a mental health issue that wasn't dealt with properly. And let me say before Senator Stabenow and I talk any more about mental health, and I believe I'll repeat this again to be sure we know what we're talking about here. People with mental health conditions are not dangerous. Mental health is a health issue, and we ought to treat it as a health issue. But in rare and tragic occasions, people with a mental health issue undealt with can become dangerous, and that's what we've seen in this and other similar circumstances. And so one of the responses is always, well, we need to have a better mental health delivery system, and that's true. But we should realize that according to National Institute of Health, for at least a decade now, they've estimated that at least 1 in 5 Americans has a diagnosable and almost always treatable mental health or behavioral health issue. And frankly, the pandemic made that even greater. A June 2020 survey by the Centers for Disease Control and Prevention found that 41% of adults in the United States said they'd had at least one symptom of a mental health condition in a recent time. And 11% said they'd seriously considered suicide in the previous month. Now, those are extraordinary numbers, but even if they were, half of those numbers were correct, you see the size of the problem we have and the importance of dealing with that problem. Of course, we had even more alarming numbers with children and young adults during that, lockdowns, months of virtual learning, time away from their friends, I'd argue too much time on screens. The effect of the pandemic on close family members had a staggering toll on the country. Children's hospitals saw mental health emergencies among 5 to 17-year-olds increased by 14% in the first half of 2021 compared to 2019. And a 45% increase in self-injury and suicide for children in that age group. Pediatric hospital needs, pediatric mental health care needs are greater than they've ever been. We need to be sure that everyone who has a mental health crisis or has an ongoing mental health problem has the help that they need when they need it. The bipartisan legislation we're debating today expands access to high-quality mental health and behavioral health through what Senator Stabenow and I will point out we believe to be a truly proven model of community-based care. The Excellence in Mental Health program, a program that we brought to the floor in 2013 and then got signed into law in 2014. At the time, Senator Stabenow mentioned that bill marked the most significant expansion of community mental health and addiction services in decades. When we pass this bill, it will be even more dramatic in its long-term impact. And we've worked on these issues together with pilot states. We've worked on these issues together that brought projects in individual states that weren't part of that 8-state and eventually 9-state pilot. And so today we're able to come with 5 years of history in this program, a reimbursement model that matters and results that we think make a big difference. And I'm glad to be here with my good friend from Michigan, and we're going to kind of do this together for the next few minutes, talk about what can happen because of a critical piece of this community safety bill that is in so many ways a mental health and mental health delivery bill that we're going to see expanded in the country in unique ways. And Senator Stabenow, I'd like to turn to you for a few minutes to talk about this, and then I've got some things I want to say too.
Well, thank you, Senator Blunt and Mr. President. Thank you. And I have to say, this has been a wonderful partnership and a wonderful journey now for, gosh, almost 10 years, I think, that since we originally started talking about the idea that we should be funding healthcare above the neck, the same as healthcare below the neck, as part of the healthcare system. And not through stop and start grants when we have community health centers are so wonderful for physical health. And so we have done that. I do want to, before going into the substance, give a shout out though, because we're not the only ones that have been working for almost 10 years. Our wonderful staff, Alex Graff on my staff, who has been working on this legislation for 8 of those years, and Caitlin Wilson on your staff, who was amazing, and I understand recently stolen by Senator Cornyn, and so she's continued her work. But so many people have worked with us that we're very grateful to, including the main authors and the folks that have put this bill together, like Senator Cornyn, who has been such a strong supporter of what has become an evidence-based quality initiative. We don't have to make something up. And when folks say, what do you want to do about mental health care or addiction care, we actually have a proven model now. And also to Kirsten Sinema and to Chris Murphy and Senator Tillis, so many people have been supportive of this as well. And I just want to take us back for just a moment, because when we came to the floor, Senator Blunt, when you mentioned 2013, we actually came to the floor to mark the 50th anniversary of President Kennedy signing the Community Mental Health Act. And as we know, that was the last bill he ever signed before himself being shot. And part of that was to stop housing people in hospitals, just locking people in hospitals, and create more quality care in the communities. You know, shut the hospitals, open up services in the community. Well, and as you have said so many times, half of that happened. The hospitals were closed, but we didn't provide the quality and the funding, permanent funding for the community care. That was 1963. We're doing it now in this bill. That's what we are doing in this bill, is completing what was promised in a national bill signed in 1963. So we know, again, that 1 out of 5 people in our country, and this is before COVID, will have a mental illness in their lifetime. So many leading cause of death, again, prior to COVID, for people under age 50, is a drug overdose, most likely opioid overdose. We know that the leading cause, the most likely gun death, is a suicide, which, by the way, in this bill, there's an important piece on red flags that I think is so important, because that means that if a family member, if those around someone feel that they are a danger to themselves and someone else and should not have access to a gun, they can go through a legal process to have that happen, so that that person is not using a gun to commit suicide or a suicide homicide through a mass shooting. But what is so significant about this is that we know that across this country, certainly across Michigan, I know in Missouri, we have so many people. I mean, there are millions of people today that want to be able to get help for mental health or addiction as part of the healthcare system. And we want them to do that. We don't want them to be a stigma. You know, there used to be a stigma. People would whisper, he's got cancer. You know, and now we openly talk about that. And we have the wonderful programs, and people get treatment, and there's no stigma related to that. It's very challenging, but there's no stigma. We want that for mental illness, for behavioral health. So This isn't about saying every person with a mental illness is dangerous at all, at all. This is about saying we want everyone to get the help they need, and in that situation, that rare situation where somebody doesn't get help and then takes those next steps and is unstable and dangerous, we certainly want to address protecting themselves, their family, the school, the neighborhood, the community, and that's what the gun safety provisions of this are all about. Let me just say one other thing and turn it back to Senator Blunt. We now have, between the number of demonstration states we've had now for a number of years, we also have 435 clinics, many of them funded through what we developed as startup grants so that they could get started, develop the quality standards, be able to show what a difference it made. But I think we were both pretty blown away when we saw the difference it made, when we saw those original numbers from Health and Human Services, the studies that were done, both in Democratic and Republican administrations, reinforcing that. The fact that right now, if you have a 24-hour psychiatric crisis services center, which is part of this, these clinics, people aren't going to jail. 60% fewer people going to jail because they're getting the help they need, which is why law enforcement so strongly supports this. Or what's been happening is people go to the emergency room and sit because there's no place. Our jails, our emergency rooms have become de facto mental health treatment centers because there was no place else. 41% reduction in homelessness with comprehensive care in the community. And that's what is in this bill. And it really is transformative, wouldn't you say, Senator Blunt?
So, Senator, and I think the points you're making here, too, are that we now have 5 years of evidence in several states, multiple years in other states. So this isn't just assuming what will happen, but looking at what we've carefully tried to keep track of what does happen. And as you pointed out, that de facto mental health system, mental health delivery system of the emergency rooms and police, nobody was well served by that. Certainly the police weren't well served, the emergency rooms weren't well served, and people who had many mental health challenges weren't served by that as well. And seeing those numbers go down dramatically of people having to go to the emergency room for mental health services or being kept in jail overnight or longer than overnight for mental health services, nobody benefits from that system. And so we're seeing real numbers where the people that work at the emergency room, the people who are in the police department, are among the biggest supporters of this system when it gets in place. And also the whole idea of crisis intervention. There are opportunities in this law for that to happen. And in any of the new structures, whether that's drug court or veterans court or other places you'd go to try to be sure somebody is getting the help they need when they need it, there'd also be due process involved in anything added that we use this bill to be added to the system. Due process where people have a right. Once, now if there's an emergency moment, obviously you've got to deal with it as an emergency moment, but people then have a right to have their day in court as well if they are not part of that crisis intervention moment of seeing that happen. And so that's important. But in Missouri, 150,000 people are now part of this excellence in mental health effort. That's about a 40% increase on what some of the same facilities were doing before, but now they do it with more certainty that they're going to get their cost reimbursed. They do it with the right kind of staff, 365 days a year, 24 hours a day, 7 days a week. They have to be available, and the new states that enter the program will go through that same type of competition to be among the 10 states every 2 years that could enter the program and get us to all 50 states in that program, and have the kind of staff they need, the kind of accessibility they need. I think originally in our bill, which was 8 years ago now, 2014, 24 states applied to be one of that first 8 states in the pilot program. 19 of them went through the whole process, and 8 states were selected. But in the other states, there are now 30 states that have big units that were able to qualify as individual demonstration grant units to show what they could do. And we really, I think, both believe that those units in those states will become both the models and the incentive to bring the whole state into that program now that that's possible. And seeing what we're seeing with results, and also results in the non-mental health side. One of the unique things I think that this pilot did was, part of the pilot was to see what happens of the other healthcare issues that people have who have mental health concerns. And what's happened is that they've seen those costs go dramatically down. If you've got a behavioral health problem that's being dealt with, you're much more likely to show up to your doctor's appointment. You're much more likely to show up to dialysis. You're much more likely to take the medicine that's been prescribed, whether it was for your mental health situation, and occasionally that's the best way to deal with mental health, or your other health situations. And so those costs go down, and even in the immediate healthcare space, Mr. President, we're seeing that states believe they're saving money in the immediate space of healthcare. There's never been any question that in the long run you'd save money. There's never, if you treat mental health like you treat all other health, there's never been any question that whether it's the prison system or law enforcement or your personal income capacity, that all those were good things to do. I think what we've shown in these early states is that even in the immediate healthcare space, you save as much money or virtually as much money or even more money on the other health costs for the 1 in 5 adult Americans, and now big numbers among younger Americans that have a mental health problem. You save as much space with their other health problems, and 1 in 5 adult Americans are going to have a lot of other health problems. It's a pretty big segment of our society, and I think Senator Stabenow, seeing what's happened there, has also been persuasive to states as they're beginning to think about making this part of their permanent program when these pilot projects are over.
Absolutely. Senator Blunt, as we know, in the end, this is all about people. And I think what's been most exciting for me, and I know for my friend and partner, is that people's lives are changing. Opportunities for them are changing. And when we look at this legislation broadly, it is about saving lives, whether it's through issues related to gun safety, whether it's through getting the help you need, mental health help and addiction services help, whether it's making sure our schools are safer, making sure broadly services are available in the schools. I mean, it's all about creating safety and a better quality of life. And I think it's also exciting, you know, we're talking about community behavioral health clinics, that there's broader investments here on mental health as well. There's a strengthening of the suicide hotline, which is so connected to what we've been talking about today. Telehealth, we know during the pandemic how critically important that was for mental health services and so on, and that's strengthened. There's about $1 billion worth of investments in some way in our schools, school health clinics and other opportunities. What I think is exciting is that we're not only supporting schools and teachers and in all of these areas that are so important, but we're making sure that when they find a child that needs help, there's somewhere to go. Because when you're talking about really investing in transformative, certified community behavioral health clinics, that means there's a service in the community. So if a parent or if a teacher or the principal or the coach or somebody is saying this young person needs some help, they won't only be trained to identify they need help, they'll actually be able to get them help because there will be services available. And so I think that's the whole point of all of this. And I would also finally say, when we talk about funding it as healthcare, traditionally mental health and addiction services have been funded by grants that stop and start. And so you may need help or want your child to get help, but the grant that was doing that went away. Or you may suddenly decide you want to deal with your own addiction. You're finally ready. It's so hard. You're finally ready to do that. And you reach out, and the services aren't there anymore. And so this is about funding this as healthcare through the healthcare system. So it doesn't stop and start. It becomes a way of looking at healthcare above the neck, the same as healthcare below the neck. And that's why we call it transformative. And is such an important commitment. I'm so proud of everyone here that has been so wonderfully supportive and enthusiastic about taking this big step. I mean, this is an area of this bill that's a huge step that will really save lives and transform communities, I think.
Yeah. Just one final thought, Mr. President. We want to be sure that we're encouraging people to get the health care they need. If this system works like it should work, you really never know what you're doing in terms of how you've changed people's lives in the future or the lives of people they might impact. We don't want to create any stigma here that a resilient, broad-based mental health system that's part of this bill means that you should be hesitant to seek mental health help. If you've got a mental health problem, you're more likely to be the victim of a crime than you are the perpetrator of a crime. But if those problems get out of control, often suicidal thoughts first before you have homicidal thoughts. But if this system works the way it should, who knows what good you've done by just letting people go through their normal lives as contributing citizens with treating their mental health and talking about their mental health. As Senator Stabenow said, being able to talk about somebody in your family that has a mental health challenge as readily as you talk about somebody in your family that has a cancer challenge or a dialysis trip that they have to make multiple times a week to go somewhere, or medicine that they take for something else. And talking about this in the context of the good it does in making our society safer should in no way be interpreted to mean that people with a mental health concern are unsafe. But if you don't deal with that problem in the right way at the right time, it has the potential to be unsafe. Most of these shootings we've seen, the shooter goes into that shooting clearly anticipating that they will not come out of that shooting alive either. So it's suicide, it's homicide, it's things that if you dealt with that problem a decade earlier, and maybe in some cases the specific problem even a week earlier, but if you dealt with it a decade earlier, as people begin to see that, you need to get you some help. Just like if your hearing is going bad or your eyesight is going bad, people say, let's get an appointment and go see what we need to do. And anybody can be seen at these certified community behavioral health centers. Anybody can be seen. If you're covered by, it's very much based on the federally qualified health center model. If you have insurance that covers this, you can go there. If you have a government program that covers it, you can go there. If you need to pay cash, you can go there on a very affordable sliding scale. But people are seen, and nobody in our state at least, and I think this would be the case in all 9 of the pilot states, nobody who needs to be seen that day is not seen that day. Nobody who needs to be seen that day is not seen that day. And nobody who needs to be seen isn't seen pretty quickly as you have time to schedule that appointment. It changes people's lives, it changes communities, it changes the way we talk about mental health. We were, as Senator Stabenow said on the floor, the last 50 years after the President Kennedy signed his last bill into law. Now here we are almost 60 years after that bill was signed into law, taking what would be so far the biggest step toward accomplishing what that Community Mental Health Act envisioned. And Senator Stabenow, I'll turn to you for any final comments for both of us.
Mr. President, I just want to say thank you to my friend and partner, and I really do mean friend and partner. And Senator Blunt, Mr. President, thinks he's retiring. I'm not going to let him. We have really done so much important work together, and going to miss him dearly. I'm really seriously figuring out a strategy where we're not going to let you leave the building. So, but I'm very grateful, and again, for him, for all of the great staff work, and it's a day to feel good about the ability to come together and get something done.